Hello everyone, today we're going to talk about vitamin B12 and what it does to your body. I'm Dr. Petra Bracht and I'm your doctor for nutritional medicine. Yes, vitamins in general. What are vitamins? Vitamins are substances that the body needs in order for metabolism to take place at all. These are so-called catalysts. And in most cases, our bodies can't produce these catalysts themselves, but have to get them through food. Yes, and that's why we're going to take a look at what vitamin B12 is all about. Because while all other vitamins only stay in the body for a very short time, B12 is a major exception. B12 can actually be stored in the liver and in the muscles. About 2 to 5 milligrams of B12, that's really a tiny amount, but that's what is in our body. And that corresponds to about 2,000 to 5,000 micrograms. That means if the daily requirement, which is stated to be 3 to 5 micrograms, is considered, the body should have a supply for at least 3 years. It's also interesting how much B12 the body can actually absorb from what it takes in and so on. So don't think that if you take in 3 micrograms now, you're covered. That's actually not true. It has to do with what you can actually absorb. According to official sources, a deficiency in B12 is actually quite widespread. Between 25 and 30% of people in the age groups from 19 to 80 actually have far too little B12, with women being affected more often than men. Many people think that this is only a problem for vegans. But mind you, these numbers also apply to people who eat meat, dairy products, fish, and eggs. So what about B12? What does it do in our bodies? And why is it so absolutely important? And that's because it's needed for DNA synthesis, meaning for duplicating our genetic cell information. It plays a major role in error-free cell division and, of course, in growth processes as well. And for all our immune cells, but also for all other cells, it's very important that there's enough available. Because B12 also regulates, by the way, we also need B12 for the maturation of our red blood cells. It's an absolute must for that. If we have too little B12, and of course that could also lead to anemia, meaning a lack of blood. And that's why you should always check when people are very tired, whether there might be anemia caused by a B12 deficiency behind it. But B12 is also actually necessary for the formation of myelin, which is the protective sheath that surrounds all nerves. And that's why, by the way, it's also called a nerve vitamin. Because B12 has so many different functions, the symptoms of a deficiency are also very diverse, and you don't necessarily think of a B12 deficiency right away. The symptoms can include nerve disorders like tingling in the hands or even in the feet, up to mood swings, states of exhaustion, irritability, depressive disorders, general physical weakness, memory problems, dizziness, and even dementia. And a deficiency can also be a reason for the development of cancer. Now, of course, you're wondering how such a common deficiency occurs. Okay, with vegans, we know they don't get it through their diet. But what about people who eat a regular mixed diet? A deficiency can also occur because there are life situations where you might need more B12 than usual. For example, in pregnant women, women who are breastfeeding, people with chronic gastrointestinal diseases, or people with liver diseases. Because B12 can be stored in the liver or also in people who are not averse to alcohol consumption. They definitely need more B12 as well. But why are 25 to 30% actually undersupplied? Did you know that, for example, when people have diabetes and take a medication called metformin, the absorption of B12 in the small intestine is prevented? And now I would like to ask you, if you know people who have diabetes, please make sure to share this video. And did you know that acid blockers, which are supposed to protect the stomach during chronic medication use, prevent B12 from even being released from food, especially if you belong to either of these two groups? To be absolutely sure, have your B12 level tested in your blood, specifically in the form of your holotranscobalamin level. Only when it's above 75 picomoles per liter can you be sure there's no deficiency. And the sources for this video can be found below the video, linked by us. For you, yes, and if you like this video, it would mean a lot to me if you shared it. And of course that you subscribe to my channel as well. And if you want to see more of my videos, you can do that up here. Yes, and until next time, I wish you to stay healthy and above all to take care of your vitamin B12 levels,